The liver is dying. 13 worrying signs that your liver is dying. Hey guys, welcome back to the channel. Today we're going to talk about a vital organ that we often ignore until something goes wrong, the liver. The liver performs crucial functions such as filtering toxins, assisting digestion, and regulating metabolism. But how do you know if your liver is in trouble? Let's find out together what are the 13 alarming signs that indicate liver problems. And the first sign that we will show you is jaundice. Jaundice is one of the most notable and worrying indicators that the liver may be experiencing serious difficulties. This symptom manifests itself with a distinctive yellowish coloration, both on the skin and in the whites of the eyes, known as the sclera. This change occurs when there is an excessive accumulation of bilirubin in the blood. Bilirubin is a yellow pigment that is formed by the natural breakdown of red blood cells in the body. Normally, the liver processes bilirubin, which is then eliminated from the body through feces. However, if the liver is damaged or diseased, this ability is compromised, leading to the accumulation of bilirubin, which then seeps into body tissues and causes jaundice. This signal is a critical alert that needs immediate medical evaluation to determine the underlying cause and initiate appropriate treatment, as it can be associated with conditions ranging from viral infections, such as hepatitis, to more serious problems such as cirrhosis or liver cancer. And the second sign that we will show you is the change in the color of urine and feces. Changes in the color of urine and feces can be significant indicators of liver problems and should not be ignored. When urine has a darker hue, often compared to the color of tea or Coca-Cola, this may indicate dehydration or, in more severe cases, a high concentration of bilirubin in the blood, suggesting that the liver is not processing this substance properly. On the other hand, pale or clay-colored stools can occur if there is a blockage in the bile duct, preventing bile, which is essential for the digestion of fats, from reaching the intestine, which also affects the color of the stool. These color changes can be accompanied by other symptoms of liver malfunction, such as yellowing of the skin and eyes, itching, and abdominal pain. If you notice any of these changes, it is crucial to seek medical advice to investigate the underlying cause and receive the necessary treatment. And the third sign that we will show you is abdominal pain and bloating. Abdominal pain and swelling in the upper right region of the abdomen are common symptoms that may indicate liver problems. This pain can range from a mild continuous sensation to a sharp, piercing pain, which intensifies after high-fat meals or during sudden movements. Swelling, in turn, can be a result of ascites, which is the accumulation of fluid in the abdomen due to the inability of the liver to properly synthesize proteins that keep blood inside the blood vessels. This symptom may be accompanied by other signs of liver disease, such as jaundice and dilated veins in the abdominal area, which are visible due to increased pressure in the abdominal venous system. These manifestations are alarming and require an urgent medical evaluation to determine the extent of liver damage and the necessary interventions to treat the underlying cause and relieve symptoms. And the fourth sign that we will show you is the accumulation of fluid in the abdomen. Fluid buildup in the abdomen, known as ascites, is a serious condition that can occur when the liver is severely compromised and can no longer produce the proteins needed to regulate fluid balance in the body. This inability leads to leakage of fluid from the blood vessels into the space between the organs and the peritoneum, the membrane lining the abdominal cavity. Ascites can cause a considerable increase in abdominal volume, discomfort, and even breathing difficulties due to pressure on the diaphragm. This symptom is often accompanied by others indicative of advanced liver disease, such as prominent veins in the abdomen and legs, jaundice, and general weakness. Management of ascites often requires treatments ranging from salt restriction and the use of diuretics to medical procedures to remove fluid, and in extreme cases, liver transplantation. And the fifth sign that we will show you is extreme tiredness and weakness. Extreme tiredness and weakness are often underestimated symptoms, but they can be crucial signs that the liver is not performing its functions properly. When the liver is compromised, it struggles to filter toxins and produce energy efficiently. This can lead to a feeling of persistent fatigue that is not relieved by rest, significantly impacting quality of life. In addition, a diseased liver may have difficulty regulating blood sugar levels, contributing to a feeling of chronic tiredness. This tiredness can be accompanied by muscle weakness, resulting in a reduced ability to perform daily tasks. These symptoms can be indicative of more serious liver conditions, such as cirrhosis or hepatitis, and require medical attention for proper diagnosis and treatment. And the sixth sign that we will show you is itchy skin. Itchy skin, also known as pruritus, can be a bothersome symptom that arises when the liver is functioning improperly. This condition usually occurs due to the accumulation of toxic substances in the blood, substances that the damaged liver cannot filter and eliminate efficiently. Among these substances, bilirubin is one of the main responsible for irritation, since at high levels it can be deposited on the skin. In addition, changes in bile levels and other metabolites can also contribute to itching. This symptom is particularly common in conditions such as cirrhosis and primary biliary cholangitis, where the flow of bile is obstructed. Treating the underlying cause of itching, which is often related to liver health, is crucial to relieving this discomfort. And the seventh sign that we will show you is spider-shaped blood vessels on the skin. Spider-shaped blood vessels, technically known as arachnid angiomas, are small vascular lesions that appear on the surface of the skin, usually on the chest, shoulders, and face. These distinctive marks form when small veins dilate and create a pattern reminiscent of a spider's legs, with a central point from which several fine lines radiate. They are particularly common in individuals with advanced liver disease, resulting from hormonal changes that occur when the liver can no longer properly metabolize and eliminate steroid hormones. This leads to a hormonal imbalance that provokes the dilation of superficial blood vessels. The appearance of these arachnid angiomas is a significant indication that the liver may be under severe stress or damaged, and often accompanies other symptoms of liver disease. And the eighth sign that we will show you is the loss of appetite. Loss of appetite is often one of the first warning signs that something is not right with the liver. This symptom can be particularly worrying because the liver plays a crucial role in metabolism and digestion of food. When the liver is sick or burdened by toxins, diseases such as hepatitis, or even more serious conditions such as cirrhosis, its ability to process nutrients and aid digestion is impaired. This can lead to a feeling of early satiety, lack of interest in eating, or nausea when thinking about food. Loss of appetite can result in unintentional weight loss and nutritional deficiencies, further complicating the patient's overall health status. It is critical to recognize and treat this condition as early as possible, as proper nutrition is vital for recovery and maintenance of liver function. And the ninth sign that we will show you is nausea and vomiting. Nausea and vomiting are common symptoms that can arise when there are problems with the liver. Directly impacting the digestive system, these symptoms can be particularly persistent and debilitating, especially in conditions where the liver is inflamed or overwhelmed by toxins that it would normally help filter and excrete. In addition, deterioration of liver function can result in an imbalance of bile acids and other digestive substances, which irritates the stomach and gastrointestinal tract, leading to episodes of nausea and vomiting. This problem not only reduces the quality of life, but can also complicate the intake and proper absorption of nutrients, essential for recovery and maintenance of overall health. When accompanied by other symptoms such as abdominal pain and loss of appetite, nausea and vomiting can be indicative of a serious liver condition requiring immediate medical evaluation. And the 10th sign that we will show you is intolerance to fatty foods and alcohol. Intolerance to fatty foods and alcohol can be a telltale sign that your liver is experiencing difficulties. The liver plays a crucial role in the digestion of fats through the production of bile and in the metabolization of alcohol when this organ is damaged or overloaded. Its ability to process these elements is compromised, leading to a number of uncomfortable symptoms such as abdominal pain, bloating, and a feeling of general malaise after eating high-fat foods or alcoholic beverages. This type of body response can indicate problems such as liver steatosis, fat accumulation in the liver, alcoholic hepatitis, or even more serious conditions such as cirrhosis, all of which require evaluation and medical intervention to prevent more serious complications. And the 11th sign that we will show you is changes in weight. Changes in weight, both loss and gain, can be indicative symptoms of liver dysfunction. Unexplained weight loss can occur when the liver is unable to properly perform its metabolic functions, resulting in poor absorption of nutrients and poor energy metabolism. On the other hand, weight gain can also be a sign of liver problems, especially when associated with fluid accumulation in the abdomen, a condition known as ascites, which can be confused with weight gained by the scales, but is actually caused by fluid retention due to decreased liver function. These weight changes are of concern because they can indicate serious conditions such as cirrhosis or chronic hepatitis, and require medical evaluation to determine the cause and initiate appropriate treatment. And the 12th sign that we will show you is mental changes. Mental changes such as mental confusion and concentration difficulties, symptoms grouped under the term hepatic encephalopathy, are serious manifestations that can occur in advanced stages of liver disease. This condition results when toxic substances, which would normally be eliminated by the liver, accumulate in the blood and affect brain functioning. Ammonia is one of those toxic substances that stands out in this process. In a healthy liver, ammonia is converted to urea and eliminated from the body through urine. However, when the liver is compromised, this conversion is inadequate, allowing ammonia to accumulate and cause neurological damage, resulting in symptoms such as disorientation, mood and behavior changes, and even episodes of lethargy, or in severe cases, coma. Effective management of these symptoms is crucial and involves both medical treatments to reduce toxin levels and strategies to support liver function. And the 13th sign that we will show you is increased sensitivity to medications. Increased sensitivity to drugs is a worrying phenomenon that may indicate problems in the liver. Especially in its function of metabolizing substances, the liver is essential for detoxification and elimination of drugs and their metabolizations from the body. When there is a liver impairment, this ability is decreased, leading to a buildup of drugs in the body, which can intensify their effects and increase the risk of adverse side effects. This condition can manifest itself in various forms, including allergic reactions, increased toxicity, and even failure of other organs. It is crucial that patients with known liver problems inform their doctors about this condition so that the dosage of drugs can be adjusted appropriately or replaced with safer alternatives. If you are experiencing any of the symptoms discussed, such as extreme tiredness, changes in urine and stool color, or increased sensitivity to medications, it is crucial to seek medical advice immediately for a proper diagnosis. The liver is a vital organ that plays a central role in maintaining overall health, processing toxins, aiding digestion, and regulating metabolism. Ignoring warning signs can lead to more serious health conditions. Remember that preventive care and early detection are key to a healthy life. If you found this video informative and helpful, consider Regio. Please share it with friends and family so they too can benefit from this vital information. Thanks for watching, and don't miss our upcoming videos for more health and wellness tips.